Hey there, gentlemen. Welcome back to the channel. If you're new here, I'm Dr. Maria Hernandez, Urologist. And on this channel, we talk about the real stuff that matters for men's health after 50. Today's video is going to be different. We're breaking every taboo, answering every embarrassing question, and creating a judgment-free zone where you can finally get honest answers. Make sure you hit that subscribe button and turn on notifications, because I guarantee this is the video you've been waiting for, but were too embarrassed to search for. Let's dive in. Alright, let me tell you something. In over 10 years as a urologist, I've seen thousands of men walk into my office. And you know what the hardest part of my job is? It's not the surgery. It's not the diagnosis. It's getting men to actually tell me what's really bothering them. Guys will come in and dance around the issue for 20 minutes, before finally, almost in a whisper, asking the question they actually came to ask. And every single time, after I answer them, they look at me with this massive relief and say, "Oh my God, I thought I was the only one. I thought something was seriously wrong with me." Gentlemen, you are not alone. These questions you're afraid to ask, I hear them every single day. And today, I'm answering the top 5 questions men ask me in private, but would never ask in public. Question number 1, and this is probably the most common one I get. Dr. Hernandez, why does my penis curve to the left, or to the right, or downward? Is that normal? Is something wrong with me? Okay, let's talk about this, because there's so much misinformation and shame around this topic. First of all, a slight curve is completely normal. In fact, most penises have some degree of curvature. We're talking about maybe 10 to 20 degrees of curve in one direction or another. This is usually something you're born with. It's just how your erectile tissue developed, and it doesn't affect function at all. It's like how one of your legs might be slightly longer than the other, or one eye might be slightly bigger. Our bodies are not perfectly symmetrical, and that includes your penis. Now, if the curve is significant, we're talking about 30 degrees or more, or if it develops suddenly later in life, especially after an injury, or if it's getting worse over time, that could be something called Peyronie's disease. Peyronie's happens when scar tissue, called plaque, forms inside the penis. This scar tissue is less flexible than normal tissue, so when you get an erection, the penis bends toward the side where the scar is. It can be caused by injury, sometimes from aggressive sex or sports trauma, or sometimes we don't know the cause. Here's the thing. Peyronie's affects about 5 to 10% of men, usually between ages 40 and 70. If you have a sudden curve, pain during erections, or difficulty with penetration because of the curve, you need to see a urologist. There are treatments available, from medications to injections to surgery in severe cases. But if you've had a slight curve your whole life and it doesn't cause pain or problems, you're completely normal. Stop worrying about it. Question number 2. And guys, this one breaks my heart because of how much anxiety it causes. Is my size normal for my age? I feel like I've gotten smaller. Am I shrinking? Okay, deep breath. Let's talk facts. The average erect penis is between 5 and 6 inches in length and about 4.5 to 5 inches in circumference. That's average. That means half of men are above that, half are below. And here's what nobody tells you. Your penis can appear smaller as you age, for several reasons that have nothing to do with actual shrinkage. First, weight gain. If you've gained weight around your abdomen, which most men do after 50, the fat pad at the base of your penis can literally bury part of your shaft. You lose an inch of visible length for every 30 to 50 pounds of excess weight. That's not shrinkage, that's concealment. Lose the weight and you'll see that length come back. Second, reduced blood flow. As you age, if you're not getting as firm of erections, your penis won't expand to its full potential size. It's like a balloon that's only half inflated. It looks smaller, but it's not actually smaller. Improve your circulation, improve your erections, and you'll see your full size again. Third, yes, there can be some actual tissue changes with age. Decreased testosterone, reduced elasticity in the tissues, and poor circulation can lead to some mild reduction in size over time. We're talking maybe a centimeter or so over decades, not dramatic shrinkage. If you're experiencing significant sudden shrinkage, that could indicate a medical issue like Peyronie's disease, hormonal imbalance, or vascular problems. See a doctor. But for most guys, the answer is, you're normal. You might need to lose some weight, and you need to improve your blood flow and hormone levels. Your size is fine. Stop comparing yourself to unrealistic standards. Question number 3, and this one's incredibly common, but men are mortified to bring it up. Why do I leak a little bit of urine after I'm done peeing? I'll zip up, walk away, and then feel wetness in my underwear. What's wrong with me? This is called post-void dribbling, and it happens to about 30 to 40% of men over 50. You're not broken, you're not incontinent, you're just dealing with a very common issue. Here's what's happening. When you urinate, a small amount of urine can get trapped in the urethra, the tube that runs from your bladder through your penis. In younger men, the pelvic floor muscles are strong enough to squeeze out every last drop. As you age, those muscles weaken, and a little bit of urine just sits there until you move and gravity does its thing. The fix? Pelvic floor exercises, specifically something called urethral milking. After you finish peeing, use your fingers to gently press upward on the area between your scrotum and anus, the perineum. This squeezes the urethra and pushes out the trapped urine. Do this before you zip up and the dribbling stops. Also strengthen your pelvic floor with Kegel exercises. We've talked about this in previous videos. Strong pelvic floor muscles mean better control, less dribbling, and better erections. 2 birds, 1 stone. If the leaking is constant or severe, that's different. That could be overflow incontinence from an enlarged prostate or a bladder issue. See a urologist. But for mild post-void dribbling, you're normal and it's fixable. Question number 4. And guys, please don't skip this one out of embarrassment, because it's important. What's that smell down there? I shower regularly, but there's still an odor. Is something wrong? Okay, let's get real. Your genital area has sweat glands. It's warm. It's often covered by clothing, and it's a breeding ground for bacteria. Some odor is completely normal, especially after a workout or a long day. But if the smell is strong, fishy, foul, or accompanied by itching, redness, or discharge, that's not normal. That could be a few things. Bacterial overgrowth, usually from poor hygiene or moisture buildup. Fungal infection, like jock itch, which thrives in warm, moist areas. Balanitis, which is inflammation of the head of the penis, often caused by yeast or bacteria. Sexually transmitted infections, which can cause unusual discharge and odor. Or smegma buildup, which is a combination of dead skin cells, oils, and moisture that accumulates under the foreskin if you're uncircumcised. Here's what you need to do. Wash daily with warm water and mild unscented soap. If you're uncircumcised, gently pull back the foreskin and clean underneath. Dry thoroughly after showering. Moisture is the enemy. Wear breathable cotton underwear, not tight synthetic fabrics. Change underwear daily and after workouts. Trim or shave pubic hair if it's trapping sweat and bacteria. If you've done all this and the smell persists, or if you have discharge, pain, or itching, see a doctor. It could be an infection that needs treatment. But for most guys, better hygiene habits solve the problem completely. Question number 5. And this one scares guys more than almost anything. Why does it hurt sometimes during sex or masturbation? Is something seriously wrong? Pain during intimacy or masturbation is not normal, and it's your body's way of telling you something needs attention. Let's break down the possible causes. First, friction or irritation. If you're going too hard, too fast, or without enough lubrication, you can cause micro tears or irritation in the skin. The fix is simple. Use lubricant, slow down, and give yourself time to heal. Second, Peyronie's disease. We talked about this earlier. The scar tissue can cause pain during erections, especially in the early inflammatory phase. Third, infection. Urinary tract infections, prostatitis, or sexually transmitted infections can all cause pain. If you have burning, discharge, or fever along with the pain, see a doctor immediately. Fourth, tight foreskin called phimosis. If you're uncircumcised and the foreskin is too tight to retract comfortably, it can cause pain during erections or sex. This is treatable with stretching exercises, creams, or in severe cases, circumcision. Fifth, pelvic floor tension. Yes, tight pelvic floor muscles can cause pain during arousal or climax. This is actually more common than people think. Pelvic floor physical therapy can help. And sixth, psychological factors. Anxiety, stress, or past trauma can manifest as physical pain. This is real, it's valid, and is treatable with therapy. If you're experiencing pain, don't ignore it, and don't just push through it. Pain is a signal. Listen to it. See a urologist, get evaluated, and find out what's causing it. Most of these causes are very treatable. Bonus question, because I get asked this all the time in a panic. I felt a lump or bump on my testicle or penis. Am I dying? Is it cancer? Okay, first, take a breath. Most lumps and bumps are not cancer. Let's talk about what they usually are. On the testicles, you might feel the epididymis, which is a normal structure on the back of each testicle. It feels like a small, soft lump, and it's supposed to be there. You might have a spermatocele, which is a harmless fluid-filled cyst in the epididymis. You might have a varicocele, which feels like a bag of worms and is caused by enlarged veins. It's usually harmless, but can affect fertility. Or yes, in rare cases, it could be testicular cancer, which usually presents as a hard, painless lump on the testicle itself. On the penis, you might have pearly penile papules, which are small, harmless bumps around the head of the penis. Totally normal. You might have sebaceous cysts, which are small blocked oil glands. Harmless. You might have genital warts from HPV, which need treatment but aren't dangerous. Or you might have Fordyce spots, which are tiny yellowish bumps that are completely normal oil glands. Here's the rule. If you find a lump, don't panic, but don't ignore it. Check yourself regularly so you know what's normal for you. If something new appears, changes size, becomes painful, or you're worried, see a doctor. Early detection saves lives, especially with testicular cancer. But most of the time, it's something benign. Gentlemen, here's what I want you to take away from this video. You are not weird. You are not broken. You are not the only one dealing with these issues. Every single question I answered today, I hear multiple times every single week in my practice. The shame and embarrassment around these topics is what keeps men suffering in silence. It's what delays diagnosis. It's what ruins quality of life. Stop being embarrassed. Your body is normal, your concerns are valid, and there are answers and solutions for almost everything. If something's bothering you, ask your doctor. And if your doctor makes you feel ashamed or brushes you off, find a new doctor. You deserve care, respect, and honest answers. Drop a comment below and let me know. Was there a question here you've been too afraid to ask? Or is there another question you want me to answer in a future video? This is a judgment-free zone. If this video helped you, hit the subscribe button, turn on notifications, and share this with any man who needs to hear it. Breaking the silence starts with one conversation. Until next time, this is Dr. Maria Hernandez, reminding you that your health matters, your concerns are valid, and you deserve answers. Stay strong, gentlemen.